Look, on your screen! It's a doctor. It's a vegan. But wait, there's more. It's the bad boy of veganism, soaring high above the conventional norms of veganism and healthcare. With his fearless spirit and unyielding determination, Dr. Peter Rogers fearlessly ventures where Harvard Medical School textbooks dare not tread, revealing the untold truths that are hidden in the clouds of misinformation. Please click like to help Be Green with Amy. Welcome, Dr. Peter Rogers.
Greetings, Green Warrior, and welcome back, Dr. Rogers.
Hi.
Hi. We wanted to have a little fun because you're our superhero. So,
thanks.
Green Warrior, are you struggling with weight loss? Are you concerned about cancer? Well, today we're unraveling the intricate relationship between weight management and cancer risk and the role of estrogen in our bodies. Dr. Rogers is going to tell us how your understanding of estrogen can empower you to take control of your health and make informed decisions for a vibrant, balanced life. So, Green Warriors, have you ever heard of estrogenic chemicals before? Let us know in the comments because we're going to be talking a lot about that today. I wanted to start off with our game of true or false.
It's time for True or False on Be Green with Amy Live. Answer true or false to Amy's questions in the comments below, and Amy will ask our guest for the expert answer.
Okay, Green Warrior, as we're going to be talking about estrogenic chemicals. The presence of estrogenic chemicals in the environment is a recent phenomenon, primarily observed in the last decade. So type in your guess, Green Warrior. And Dr. Rogers, tell us about that.
Yeah, well, estrogenic chemicals, they're getting worse and worse, so they're continuing to be ramped up. But they've actually been around a lot longer than that. Okay, they put aluminum in the drinking water. It's a clarifying agent, which is in a sense a little bit crazy, putting metal into your water to make it a clarifying agent because it'll stick other particles to it. Aluminum is a metalloestrogen. That's going to be a really important point to know. Plus, like let's say one woman is on birth control pills. She voids some of that ethinyl estradiol, EE2, into her urine, goes out in the toilet, circulates back to the water. It's too expensive to remove the estrogenics from municipal water. So pretty routinely, there's a significant amount of them in your drinking water. You're drinking some other woman's birth control pills. And it's not just that. There's all these industrial chemicals. There's BPA, phthalates, PCBs. All these estrogenic chemicals are in your water. That's why I recommend at a minimum to have a carbon water filter.
Yes, that's very important. And you're not necessarily only talking about drinking water.
Oh, they're all over the place. Estrogen is a fat storage hormone. So it makes animals get fat because it's sort of is programmed. A woman, her estrogen levels are high when she's pregnant with the baby, and it tells her, store this fat. The baby might need that for energy. So when you put fat storage hormones and you feed them to, let's say, livestock animals, you fatten them up more quickly. So they're given to the livestock animals. That's another reason eating meat gives you an estrogenic effect, which I find kind of funny because, macho men think I got to eat meat to be macho and strong. And I'm like, yeah, genius. You're eating estrogen,
That's a very good point. Okay, Green Warriors. True or false, estrogenic chemicals are mainly found in processed foods and meat products. Type in your answer, Dr. Rogers.
Yeah, there's more estrogenics in processed food and meat products. And a good example is if you look at processed food, typically the cheap sweetener is high fructose corn syrup. Well, what do they spray on non-organic corn? They spray atrazine. Atrazine is a very powerful estrogenic chemical. That's the one that turns the baby male rats into female rats. Okay. The guy who figured that out was a guy from Harvard named Tyrone Hayes. And once he figured that out and he published it, he got tons of backlash, and they tried to fire him, take away all his funding, and he sort of stuck to it. And the reason I mention that is I'm letting you know it is very difficult for scientists to publish something that industry does not want published. When they do that, they often have their funding taken away. They often get fired from their jobs. And so for that reason, this type of information is harder to find. And that's another reason why a lot of times the best papers are written a long time ago before these big food commercial companies became so powerful in the advertising and the journal search. Nowadays, they just buy a journal and they only publish stuff that makes their product look good. So the old papers tend to be better, but I'm just letting you know the cheap sweeteners, estrogenic. And then what about the cheap protein? Cheap protein very often comes from soy. Soy is like thousands of times more estrogenic than most foods, okay? Super estrogenic. There's 2 estrogenic things that are likely to decrease your fertility, okay? And then, what's in your water? You're drinking all these estrogenic chemicals I just referred to, as well as the aluminum and metalloestrogen. So your water's poisoned, your food is poisoned, and your personal care products. Typical thing people with, deodorant. Let's say I'm putting deodorant on my armpit, okay? That's going to typically have aluminum, metalloestrogen in it, and it's going to have pyrobenzoic acids, estrogenic preservatives. I'll show the chemical structure of estrogen in a moment, but the point about it is, it's got 2 properties that make it super popular. It's got an aromatic ring in the corner, the A ring. It's on a cholesterol backbone, and that gives it incredible shelf life stability. It can stay on the shelf for years and it doesn't spoil. Companies want that. The next thing is coming right off it, there's going to be a hydroxyl group. So let's say there's a hydroxyl group. Hydroxyl group is antimicrobial. So it prevents, and let's say it's antifungal. So it prevents fungi from growing, prevents mold growth in a personal care product, in a food product. So they're always going to put this in there. And you can say, well, that chemical should be banned. The company will just laugh at you. Like, okay, fine, we'll ban it. And they'll just, change one little substituent on it. It's the same thing. So what I'm saying is it will always be this way. You can only win this game by minimizing your use of personal care products. I think deodorant is for chumps. I'll explain that later, but it is.
Right. And we had talked about this on another appearance that you had on the show. And it's been my finding that people who are plant-based seem not to have as bad of a body odor. And perhaps it may be because the animal products stay around a lot longer in the digestive tract and get expressed out through the pores. So that might be another reason why. Okay. True or false, men are not affected by estrogenic chemicals as they have lower estrogen levels compared to women. Okay, Dr. Rogers.
Well, men are less affected in the sense they're less likely to get breast cancer than women are, but men are still affected. For example, the prostate is sort of the male equivalent of a uterus, and it gets enlarged. And that's, why main part of the reason why prostates are so big in the Western world and so many men have to wake up so often to pee at night. And eventually they can develop worse problems than that, urinary retention and all these other things and prostate cancer. So men have problems with estrogenic chemicals, as do women. And the hyper focus tends to be on breast cancer, especially with women, but it's causing a lot of other problems as well. Obesity, for example, endometrial cancer, uterine cancer.
Yes, and that's what we're going to be talking about a lot today. We're talking about the estrogen and the connection between cancer and obesity. And we're going to learn a lot more about that. And you're going to be doing a presentation a little bit later on in the broadcast to give more details and some slides so that we can actually see what that's all about. Okay, so our next question is, true or false, the use of non-toxic toothpaste containing triclosans is recommended for oral hygiene? Didn't think about toothpaste, did you, Green Warrior? What do you say, Dr. Rogers?
Yeah, I think toothpaste is very overrated. For example, I would never use stuff with F- in it because that's toxic in multiple ways. It inhibits glycolysis, it inhibits electron transport in mitochondria. In addition, so F- will kill the bacteria on the back of the tongue, which convert, when you eat greens, you have a 3-carbon nitrates. They're converted by these bacteria that are commensal with us on the back of your tongue into nitrites. That's NO2. And then the NO2 goes down your esophagus and your stomach. And then the stomach acid helps convert that to nitric oxide, NO, nitrogen, oxygen. And that's a systemic vasodilator that improves blood flow throughout your body. You also have subcutaneous nitric oxide precursors. And when you walk in the sunshine, that activates them and you feel good. So what I'm basically saying is you lose a lot of your vasodilation, increasing your risk of becoming hypertensive, for example, by using F- in your toothpaste. Okay, so what else? Triclosan is also toxic. It's estrogenic. I would avoid it. I don't brush my teeth very often. And then I haven't been to a dentist in over 25 years. And the reason I say that is I had to get a cavity filled many, many years ago, and I did not like it. I did not like sitting in that chair. I did not like the slow drill. I said, I don't want to ever do this again. I read like 5 books on dentistry. I go, how can I avoid this? And the gist of it was that if you avoid sweets and you avoid acidic things, like soda pop with the phosphoric acid, or OJ is also very acidic. And you avoid those things. After I eat, I'll rinse my mouth off with water. At night, you always want to floss because your saliva production goes down. So your mouth is dry. That predisposes you to getting cavities. So definitely, use those little interdental brushes and floss at night before you go to bed. So all the spaces are clean. and you probably won't have any problems. And indigenous populations eating their old-fashioned traditional diets. There's a guy by the name of, what was his name? He was a dentist, Western Price, okay? And I know the Western Price Society, I don't agree with a lot of things they say, but he was a pretty cool guy. He traveled all over the world studying people's teeth, and he found out people eating traditional diets with none of these sweets or soda pops or white flour, they didn't get any cavities. Their teeth were fine. So that's kind of what you want to go towards. Like I said, I haven't been to the dentist in over 25 years. I don't have any problems with my teeth. And I like not having to go to the dentist. I'm a big believer in learn how to take care of yourself. And then you don't need a doctor or a dentist, hardly ever.
Well, I'm all about the dentist not going if I don't have to, because I've never had a good experience either. Okay. And going along with that, because you had talked a little bit about fluoride, so that would be something that a dentist might offer, would be a fluoride treatment.
Yeah, dentists don't know what they're talking about with regard to fluoride. They're going to tell you, oh, it's good for teeth. It has a very questionable, minimal benefit to teeth. There's a small minimal benefit. I've seen mixed, papers both sides, but it's a pretty small benefit. And it comes with a lot of toxicity, okay? It lowers IQ. It makes people more docile, like a bunch of cows. And think about it. Who puts it in your water? Your municipality. They want you stupid and docile, you dummies. So that's why, you want to avoid it if you can. How can you remove it? You can remove it with that reverse osmosis in your kitchen. You can move it with distillation, but that's a pain in the butt. This ion exchange filters maybe can do it. I don't have that much experience with them. It's a relatively new thing from my experience. You also can move to an area where you've got, they don't put it in the water, that city, or get well water or something where it's not in the water. Test the water before you move there.
Right. Yeah, you definitely want to test the well water, because you don't know what you're getting to there. And the RO systems, the reverse osmosis systems, you can get a whole house one, but you could get one just under the sink in the kitchen if you wanted to. And they're pretty easy to install and take care of. Okay, Green Warriors, true or false? The estrogenic effects of chemicals in personal care products can be amplified when used in conjunction with certain medications. Okay, Dr. Rogers?
Yeah, well, they all add up together. So you're getting estrogenics from your food. You're getting estrogenics from your personal care products. Some medications will have estrogenic type side effects. So my advice is to try to minimize everything. I recommend, kind of live like Adam and Eve, but keep your indoor heating and plumbing. Most modern stuff is really not that good for you. I'm real kind of old-fashioned and simple, because I find that makes me more effective at the things I want to do.
Okay, here's something that we touched upon a little bit, but we're going to go over it. True or false? Estrogen can cause a person to gain weight by signaling the body to store energy, particularly during pregnancy. Okay, what do you think, Green Warrior? Dr. Rogers?
Yeah, it's a fat storage hormone. So it encourages a person to gain weight when they're ingesting a lot of estrogenic chemicals.
Mm-hmm. And that's something that I think that Green Warriors are going to be interested in, because oftentimes people adopt a whole food plant-based lifestyle, or at least they try to, and they don't see the results that they would like, and they really think that they're being very strict about it, and yet they're still not having any results as far as losing weight. And that's why I am enjoying this topic today, because it goes beyond just what kind of food you're eating. It does go into some of the other things that we're exposed to, and we're going to learn more about that in your presentation today. Okay, true or false? Fibroids are less common in families that consume organic meat and filtered water. Dr. Rogers?
Yeah, that'll lower your risk. And I have known some women, they've told me, Dr. Rogers, every woman in my family had to get a hysterectomy before the age of 35. And it's almost always because of fibroids. And so, I talk to these people, and they're drinking tap water full of estrogenic chemicals. They're eating a lot of meat and processed food full of estrogenic chemicals. So, you don't want to be doing that, because, the reality is it's dangerous to be ignorant, because people are making themselves sick. Okay. The classic saying is, most men dig their own grave with a fork and a knife. And so what you want to do is learn about food. And nowadays it's not enough to learn about food. You also got to learn a little bit of toxicology, which is pretty easy to learn. You just have to be aware of it and make the effort.
Yes, very good. That makes a lot of sense to all of us. Okay, let's talk more about women. True or false, high estrogen levels can contribute to dysfunctional uterine bleeding and increased menstrual cramps.
Yeah, it can cause a lot of somewhat unpredictable female symptoms with menstruation and whatnot. And, it was said that back, you go back before like 1975 in Japan, they didn't even have a word for menopause, really. They would simply stop having periods. But what I'm trying to say is they didn't get all these symptoms like all these American women. And they think it's because the American woman had lots more estrogens in addition to what was part of their normal bodily production, from their diets, their water, their personal care products and stuff. So they're more likely to get these postmenopausal hot flashes and other problems related to menopause.
Okay. So, true or false, endometriosis can result in infertility and severe pain, often leading women to opt for surgical intervention without considering estrogen reduction.
Right. And so what I'm going to say is one of the most valuable things you could learn is that you should always know what your problems are and study your problem and ask yourself, is there another way to do this? Because conventional medicine, the doctors do not learn nutrition, epidemiology, and toxicology. Those three things, those are the most important topics for understanding what causes diseases, what can prevent disease, and how to treat disease. So that's why I think, pre-med education is a joke. They study all this stuff: calculus, physics, inorganic chemistry, organic chemistry, physical chemistry. But for learning about disease and health, that's nonsense. It's irrelevant. And I mention that because people say, well, my doctor is a specialist. And I laugh too, because I know medical school basically is training to be an internal medicine doctor. And medical students, they don't learn nutrition, toxicology, epidemiology. So here's what I think is funny. If you just watch these videos for a week or so, you can learn more than a student will learn through 4 years of pre-med, 4 years of medical school, 3 or 4 or 5 years of residency. They don't know these things. I guarantee you, I talk to doctors every day. They do not know these things. All right. So what I'm trying to say is conventional medicine is called allopathic medicine. There's also DO, doctor of osteopathy. But basically, they don't know almost anything about the things I just talked about. And that relates to the hormonal effects because they don't know toxicology. So what I'm saying is what they are trained in is in drugs, and then the specialists are trained in surgery. So they know drugs and surgery. So if you go to an allopathic physician, you are going to be consulted about drugs and the possibility of surgery versus sometimes that's the best thing. But there's a lot of problems. You can cure them just by fixing your diet. Why not fix your diet and be cured rather than having somebody operate on you?
Well, let's go even further for women. Infertility, true or false, infertility in women can be partly attributed to exposure to estrogenic chemicals, which may hinder ovulation and thyroid function.
Yeah, and the other thing I've noticed is lots of people, and don't get mad at me, but I think it's more common in women than men, they have a different view of the world, okay? In my experience, women, because men, we like you guys about 100 times more than you like us, okay? You kind of think we're a little bit disgusting and scary, okay? And so what I'm saying is they have this idea that someone's going to take care of me. We've got institutions and associations monitoring the water safety, the water quality, the food safety, the food quality. And I got news for you. No one cares about you. A lot of people prefer you're gone, okay? There's nobody watching out for you. I hate to say it, but there is no one watching out for you. Your food is poisoned. Your water is poisoned. Your air is polluted, very seriously polluted. So you have to learn to navigate this complex environment if you want to optimize your health. Okay, like my kid came to me one time and his teacher, he thought gave him an unfair grade. This was many years ago. And I don't know, he's like in junior high or something. He goes, Dad, it wasn't fair. And I said, well, let's talk about it. And sometimes life is unfair. I said, you're like a rabbit. Imagine a rabbit hopping down a bunny trail, okay? And one tree up there, there's a hawk, wants to eat the rabbit. Over there, there's a snake, wants to eat the rabbit. Over there, there's a couple coyotes want to eat the rabbit. And I said, if the rabbit's going to survive, he better realize he's not going to make friends with them, okay? He has to have a system of burrows. He has to pay attention to the birds, the radar of the forest, and learn how to stay safe, okay? Navigate the trails. And what I'm trying to say is it's the same thing for our health. once you're aware of these things, you can fix your water. You could filter your water. You could avoid these non-organic foods. You could avoid processed foods. You don't have to be a dummy putting deodorant on and using a lot of these other personal care products. You can dramatically reduce your estrogen. The rates of breast cancer are minimal compared to what they are in the United States. So a typical stupid person goes, well, I'm going to go get my mammogram. They think that's intelligent. Versus, why not just prevent the problem? You go for your mammogram, you start going at a young age, they're going to get all these false positives and scare the crap out of you, unnecessary biopsies, unnecessary surgeries, overtreatment, you can do that if you want. Look at Peter Gochke's findings on that. The best doctors I'm aware of recommend not even going for mammogram at all. I know a lot of people get bent out of shape when I say that, but if you really study it, and I'm just saying is, why not prevent the problem? That's the smart thing to do.
Right. And there are even some women that are going for the preventative, is what they think it is, the vasectomies, because they had the test for the HR2. So it really, that's a dramatic thing to do, where maybe it's not so dramatic just to change your lifestyle. Okay. Well, this is something interesting. True or false, morning sickness during pregnancy is exacerbated by high levels of estrogen. What do you think, Green?
Yeah, it's more common in women that are being exposed to a lot of estrogenic chemicals. And I think part of what morning sickness is trying to get the woman to be healthier in her habits. So I think that's a very under-recognized. And also, I think this is a thing where the OB-GYN doctors have really screwed up. They really should know more about nutrition, and they don't. They'll recommend a folate supplement. Where does the word folate come from? For foliage, for leaves. Eat your greens, okay? So that should be the kind of thing that's being talked about, but it isn't talked about that often. I know some infertility specialists, and I came in, and then they asked me questions. They were thoughtful enough to ask me questions, and I explained all of a sudden. They're like, wow, that was really helpful. Thanks. It's not in their literature, okay? These are the people that are dealing with these problems, because the rate of infertility is off the charts, okay? And it's only going up. So if you're a young woman and you want to have a baby, you want to know about this stuff, and you want to plan that carefully so you'll be able to have a baby,
Yes, that's important to know. And speaking of babies, true or false, male babies born to women with high estrogen exposure are at a decreased risk of developing hypogonadism related conditions. So
yeah, there's a lot of problems. If the mother's nutrition is not good, it increases the likelihood the baby's going to have complications. There's such a thing as epigenetics, and if she's exposed to so-called obesogens, the baby's more likely to be obese. And what I'm saying is, a mother should spend some time learning about nutrition. What is the best nutrition for my baby? What is the best nutrition both while she's pregnant, for her, the pregnant mama, and then also for the baby? I mean, if possible, she should try to breastfeed. But even if she's breastfeeding, she wants to be healthy, so her breast milk is of optimal health for the baby.
Yes, and breast is best.
Yeah.
Yes. Okay. True or false, estrogenic exposure can lead to a weakened immune system, increasing the likelihood of autoimmune disease in women.
Yeah, estrogens have a bit of a schizophrenic effect on the immune system. And what I mean by that is, think about having a baby. A baby has some of the DNA of the father, so it's like having a transplant. And her immune system, is not supposed to reject the baby. And so what I'm saying is, estrogenic chemicals have a tendency to increase the immune system in some ways and suppress it in other ways. And paradoxically, they can cause a lot of autoimmune disease. About 80% of autoimmune diseases in women. So they're much more at risk for autoimmune disease. All this stuff like lupus, multiple sclerosis, rheumatoid arthritis, and there's a whole bunch of other ones.
Yeah, and that's something good to know, because again, oftentimes people may find themselves going for a plant-based diet because they think that may help their autoimmune disease, but there's other factors as well that we really need to know about. And I'm glad that you're here to talk about it, and you'll be talking about it in detail with your upcoming presentation. Green Warrior, true or false, postmenopausal women are less likely to experience hot flashes in regions where traditional diets are prevalent, such as Japan? Dr. Rogers?
Yes, they had a lot less, much less postmenopausal symptoms, often none other than the period stop.
Hmm. Well, that's good to know. I know there's a lot of women out there that are suffering with those symptoms, and sometimes their spouses are suffering along with them because of ceiling fans and things like that. Okay, let's see if we were talking a little bit about this earlier. True or false, increased estrogenic exposure is associated with a higher risk of benign breast masses and breast cancer development in both women and men.
Yeah, so the women not only get more breast cancer, they get more fibrocystic disease and problems. And these things can be very cumbersome because, you go for a mammogram, they might be indeterminate. And all of a sudden you find yourself going for follow-up mammograms, ultrasound guided biopsy, and be nice to avoid all that stuff.
Yeah. Green Warrior, true or false, estrogenic exposure can contribute to psychological issues such as depression and postpartum depression. Dr. Rogers.
Yeah, they're more vulnerable to all this sort of stuff. If you look at a female brain versus a male brain on a MRI, sagittal, midline sagittal, the only difference that I can quickly appreciate, and by the way, I've seen many, many tens of thousands of brains, is that a premenopausal female's got a much bigger pituitary than a man of the same age. Okay, and all through life, women have bigger pituitaries than men, and they're just more vulnerable to hormonal problems for that reason because they have, they got the menstrual cycle. Okay, so they're more prone to postpartum depression. They're a little more prone to depression and anxiety, which sometimes surprises me, because from a guy's point of view, we think you guys have it easier than us. And I know you think that you have it harder than we do, but women tend to be more vulnerable to these things. And I think tremendous amount of mood is related to food. And it's wise to be smart about it. I've given previous lectures, like I talked about this a lot in my dementia lectures. There's a lot of chemicals that excite the brain. I call them excitotoxins, things like glutamate, MSG, MFG, glyphosate's also an excitotoxin, aspartame, the sweetener. And all of these things will ramp up metabolic activity in the brain. And then simultaneously, there's vasoconstrictors, psychological stress, the catecholamines, as well as drinking caffeine. They decrease brain blood supply. So that's a bad situation when you're increasing brain metabolic rate, but dropping oxygen and glucose delivery, dropping brain oxygen and glucose, blood supply. So what happens is the neurons kind of are agitated without being able to meet their metabolic demands. And if it's a small neurovascular uncoupling, they can kind of get by, but might be just suboptimal in their function. But the bigger that gets, as they start getting older, they're more likely to lose those neurons and gradually become demented. While they're younger, they're more likely to have symptoms like anxiety, distress, and other emotional symptoms. So what I'm saying is when you optimize your diet and your habits, you improve your cognitive function, you improve your mood, you calm down. And I think that might be related to, like, sometimes I've interacted with the paleo carnivore keto crowd, and they're incredibly rude and vulgar on their comments on the internet. They really are. The vegan community is 1,000 times better behaved.
Well, I'd like to think so. Okay, true or false? Polyester clothing can contribute to increased estrogen levels in the body. Dr. Rogers.
Yeah, some of these chemicals, they're related almost like to the artificial plastics, and they can have an estrogenic effect on a person. Like for a guy, you don't want to be wearing, polyethylene underwear, okay? Having an estrogenic effect on your privates. That's, like I said, you want to be kind of simple. I like to use cotton, and there's even special types of cotton that are just likely to be pesticide sprayed, and I'll wash them a couple times before I'll wear them. And it's kind of funny. I have a lot of old clothes that I've had for over 25 years. I'm the same size that I've always been. And so my family always yells at me, how come you don't buy any clothes? Because I'll ask you, my kid will want money. I'm going, well, sell my clothes. You go, why don't you buy some new clothes? You're pathetic. But that's why I do it, because I don't want the new clothes with all their chemicals. I don't like going to the store.
Well, it can be a waste of time. And now they're putting a lot of things in clothing, right? Not just the polyester that we have to think about, because they're adding some flame retardants and other things as well.
Oh yeah, you could get sick from clothes. You could have polyethylene estrogenic chemicals in your polyester clothing, number one. Number two, they'll put, like, let's say all these no wrinkle shirts, they're going to put formaldehyde in there, which is neurotoxic, make you stupid. It's that's your no wrinkle shirts and your dress shirts. They'll have sprayed pesticides on it to begin with. And there's other chemicals. Plus your laundry detergent's toxic too. I don't even use laundry detergent. You don't need to. I just rinse it, extra hot in the washer, and then in the dryer, run it a little longer. It's fine.
Yeah, because typically, especially as adults, we don't usually have stains very often on our clothes.
Yeah, if you're working on an oil rig, okay, it's going to be a little worse. But look at your typical laundry detergent, okay? It comes in a BPA bottle that's conditioned with phthalates. There's 2 estrogenic chemicals right there. Typically, you got something like nonylphenol or something is the chemical that's your detergent. That's 3 estrogenics. And then those anti-wrinkle little things you throw in the dryer, that's 4 estrogenics. It's in contact with your skin all day long. Your skin is primarily lipid. It's designed to keep water out. That's why when you can jump in the pool in the ocean and you don't quickly gain 20 pounds of water coming into your body, okay? But like dissolves like in chemistry, so you absorb the lipids of these estrogenic chemicals that are put on your body in a personal care product, in a moisturizer, a sunscreen, a cologne, a perfume, deodorant, whatever. And so you're taking in all these estrogenics. So the laundry detergent on your clothes is all day long coming into your body. And it's even worse than that because imagine you drink water with estrogenic in it. About half of it will get removed by your liver in the first pass effect, detoxification. But when it comes into your skin, transdermally absorbed, it doesn't go to your liver. It just travels around your body. So it'll have more of a direct toxic effect. And you're sitting with that stuff on yourself all day long.
Yeah, I often think about how there are some drugs now that are delivered via patch. And so people will get a nicotine patch or some other kind of patch. And so they put this patch with the chemicals on it onto their skin and it goes into their bloodstream. And I think that that's important for people to understand that, as you said, things get transdermally absorbed through our skin. And it's not just the things that we intentionally put there. Okay, true or false? BPA has been completely banned from all consumer products. As long as plastic is BPA free, it is safe. Dr. Rogers?
Yeah, so I'll answer the BPA question, but getting back one sec to water, if your shower water doesn't have a carbon filter, you're showering in estrogenic chemicals, and so some of that's transdermally absorbed. That's why it's nice to have a whole house carbon filter. Okay, that's like what I have is a whole house carbon filter and a kitchen reverse osmosis filter. And I'm in an area where we don't have F- in the water. So that's what you want. Getting now to BPA, I'll show the chemical structure of BPA. All estrogenic hormones are on a cholesterol backbone. Estrogen-like chemicals have that aromatic ring, a benzene ring, and then they have the hydroxyl group coming off, like I just said. So the joke of BPA, it means bisphenol A. So bis means two things, 2 substituents that are on opposite sides of a molecule. Okay, and the reason I mention that is there's an intervening component in the middle. There's like 3 carbons right there. Okay, so what I'm saying is all they have to do is switch out the middle component. There's a phenol group on each side, which means a aromatic ring, benzene ring with a hydroxyl group on it. And you got the same effect. Instead of calling it bisphenol A, they can have a BPS, bisphenol sulfate. Okay, they can put other things in the middle there too. And so you're still going to have the estrogenic effect. It's a big joke. Like I said, the companies will never change. They make billions of dollars with this stuff. There's no reason for them to change. They'll always have a workaround. So that's why I'm saying is you can never think that someone else is going to save you. You have to learn how to save yourself. And it's pretty easy to do. Anybody can learn this. If you watch this lecture today, you'll know estrogenic chemistry. It's not rocket science.
Right. And speaking of the BPA, I heard you say that there are women, especially, who think that if they drink a lot of water, that will help with weight loss, and they'll often carry around a plastic water bottle. So
yeah, I laugh because 30 years ago, all the fat ladies were drinking diet soda pop. Nowadays, if you see a gallon jug of water on a table, a fat lady sitting there. And I mean a little bit mean, but what I'm trying to say is I see all these fat women walking around with a big thing of water thinking they're going to lose weight. The poor women, they're ignorant. They're drinking probably, tap water with estrogen in it. It's not going to help them lose weight. I never seen anybody lose weight doing that, but I know that's a common habit.
I worry about plastic bottle as well.
Yeah, in the plastic bottle, putting plastics in there. And then I often see, so I don't think that's a good idea. I worry about water intoxication too. If the water, depending on how hypoosmolar it is, our blood osmolality is about 300. It's not exactly the same thing as TDS, total dissolved solids in water, but it's a close analogous concept. TDS is like, it looks like the size of a pen. You put it into water and you can then check the number of particles per square centimeter, for example. So what I'm saying is tap water, let's say it's in the ballpark of 500 TDS, carbon filter water in the ballpark of 200 TDS. If you reverse osmosis something, it'll be 10 to 110, about that. Distilled will be 0 to 2. So what I'm saying is, even that bottle will say, well, my bottle of water is filtered. Well, be careful, because if you're drinking too much of that stuff and it's markedly hypoosmolar, it can distort the osmolality in your blood and be harmful to your brain. If you look up water intoxication, like marathon runners, they're taking a drink, some of these people, every 500 yards, and then they become hypoosmolar. They had seizures at the end of these races, even died. So you don't want to be drinking that much hypoosmolar. You could do something. You could take a lemon and squeeze a lemon in it, or squeeze something else into the water, add some particulate matter in there. But be careful about drinking large volumes of hypoosmolar fluid.
Yeah, and that's something that oftentimes we had discussed earlier about women who think that if they drink a lot of water, that will help with weight loss. But people who have adopted a whole food plant-based diet, especially if they are eating a lot of fresh fruits and vegetables, they're absorbing a lot of water just through their food. So you would say that probably they don't have to be worried so much about drinking water unless maybe they're outside working and perspiring. What would you?
Yeah,
say
I don't even hardly drink any water, because, like I said, I eat all these plant foods, and plant foods are very hydrated.
Yeah, and if we drank too much water, that could be a bad effect on us as well. So I worry sometimes about people, especially if they've adopted this lifestyle. I think that when people have not adopted this lifestyle, they're eating a lot of high salt foods because it's processed foods have a lot of salt hidden inside of them, and I think that might be one reason why.
Yeah, another thing too is, you go back to like around 1970 and before that, the world marathon Olympic champions, they didn't even drink any water during their race. So, and a person can handle that. All right. Nowadays, they'll drink more water. They'll also often drink sweets because, in the middle of a race, sweets give you more energy. So you can do that for a long marathon-like race. But what I'm trying to, and also I was a wrestler in college, we didn't drink any water till after practice. We could sweat off 5-10 pounds pretty routinely. So you don't need to constantly drinking water. I see people at the health club, they're got their water bottle, taking a sip, and they're barely doing anything. It's a big joke. So you don't need to drink that much water. Water, this idea of 8 cups a day, 8 bottles a day or something, that all started like in the late 1980s, in that ballpark of time when they started selling bottled water. I never heard of that until after I was done with my athletics career. And so what I'm saying is, that came when they started selling Gatorade and when they started selling bottled water. And you think about it, it's stupid, because let's say you got a 350-pound football player lineman, okay? Does he need 8 cups of water just like a 80-pound woman? Oh, come on. And the different sized person, different level of activity, different climate, it's going to need different amounts of water. This 8 cups a day for everybody, it's obvious nonsense.
Okay, well, that makes sense. Thanks for talking about that. Okay, I think we're done with our true or false segment now. And Green Warrior, if you have any questions for Dr. Rogers, please go ahead and put them in the chat, and we're going to bring that up a little bit later on in the broadcast. And then we're going to now shift to Dr. Rogers' presentation. Dr. Rogers is about to delve into the fascinating topic of estrogen, and it's linked to cancer and weight loss. So he's going to be expounding upon the things that we were just discussing. So get ready for some eye-opening insights that could change the way you view your health journey. All right, Dr. Rogers, I'm going to, if you want to take your presentation and pull that up, and then, and let's watch this.
Okay, so you take a look at this slide and you see this lady, she's put her estrogen to good use. Okay, she's got big breasts, she's got a Virginia down here. It makes sense that she has estrogen, right? Now take a look at a soy plant. I don't see any breasts. I don't see a Virginia. Why does soy have thousands of times more estrogen than does other plants? And it makes me think, we talk about, let's say a lot of fruits, and the animal eats the fruit, and then let's say a bear eats the fruit and it walks a couple miles and then it defecates, and then a new fruit tree grows in that spot. So that's a win-win relationship. But there's some plants, they don't want to be eaten. And what could you do if you didn't want to be eaten? Well, you could make chemicals that would make the animal that ate you infertile, so that there would be less of them and they would stop eating you so much. And soy does increase the risk of infertility. Okay, so it can also make a person hypothyroid and stupid. I think soy is one of the most overrated foods around. So just letting you know that one. The other thing is there's a lot of guys that drink beer, and beer will often have estrogenic chemicals in it. And they get fat and they say, oh, look, I've got a beer belly. And what I'm saying is, they look like a pregnant female, and their boobs, they call them man boobs or moobs, they're not just fat. You look at them on a CAT scan, you'll see that very often they have a little bit of breast ductal development in there. The word for men having breast ductal development is called gynecomastia, okay? Breast like a woman. So these guys that think they're cool with a beer belly, I think they're fat and stupid, and they look like they're pregnant. Okay, here's a lady's breast right here, and these green lines are the lymphatics. So she's got lymph nodes in her armpit, and they are in contact with the upper outer quadrant of the breast. It used to be only about 30% of breast cancer was in the upper outer quadrant. It's a little bit bigger than the other quadrants if you divide this into fours. But nowadays, it's about 60% of breast cancer is there. And I think it's deodorant is the main thing that's changed, causing that increased risk factor. There's a United Kingdom scientist by the name of Philippa Darbra, and she's done a lot of research on this. So here's the point. This lady right here, look at her armpit. She shaved her armpit, which is going to, cause little cuts in the skin. It's going to increase transdermal absorption. The deodorant's got aluminum in it because that plugs up the sweat pores, and it's also going to have preservatives, typically something like power-benzoic acid. That's 2 estrogenics, and she rubs it into her armpit. Because she shaved, she gets increased transdermal absorption. It goes into the armpit lymphatics, which are shared with the breast. The aluminum is a metalloestrogen. The power-benzoics are just, regular estrogen. So she's increasing her breast cancer risk. You don't need deodorant, okay? When you walk in a room, people say, hey, how you doing? They don't walk. We're not like dogs. We don't walk up to each other and sniff each other. Plus, I've had over like 1 million conversations in my life with guys about women. I never heard a guy say, oh, I don't want her. I'm not attracted to her because she smells funny, okay? Yeah, it's true. Vegans smell better than meat eaters. But if a guy's attracted to a woman, he's attracted to her whether or not she smells bad, okay? Or a little bit different from the meat or the plants. And so then you talk about breast cancer. Everybody's so sad, and somebody's dying of breast cancer. So they get a pink ribbon and they run around in circles, say, we're raising money for breast cancer. But you're just raising money for the chemo company. And nobody tells these women anything, like empowers them and say, look, if you want to reduce your risk of breast cancer, learn how to avoid these estrogenics. Don't use these personal care products. It means you're stupid. It's not a way to show off. It means you're stupid. And there's a whole bunch of them. The shampoo, the conditioner, the soap, the moisturizer, the cologne, perfumes, okay? All that stuff is estrogenic. Sunscreen lotion. You don't even need sunscreen. Now, there's a long story, but I'll go into that later. So that's a way you minimize your breast cancer risk. Filter your water so you don't get the estrogens from the water. Don't eat meat. Avoid processed food. You'll dramatically lower your exogenous. That means chemicals outside the body exposure by doing that. You don't need detergent in your laundry. All of these things will dramatically lower your risk of breast cancer. Okay, and here's like how the kind of advertising, you should wear deodorant at night. Yeah, right. How stupid is that? Then you would be doubling the amount of stuff you're putting in your armpit. So don't trust commercials. I would even say be very cautious about trusting modern science. Most so-called science in the modern journals is fake. The rich companies have bought the journals, and they pay scientists to publish stuff to make their products look good. It's just a fact. And I'm going to go through the life of an average American, for example, and you see why they're so messed up. And like a typical thing a patient will say to me, I'm talking to this poor fat patient, guy in his, let's say in his 50s, it could be a guy in his 60s or his 40s, but he'll say to me, doc, I don't think it's my diet. I think it's genetics. And I go, well, why do you say that? And he goes, well, because everybody in my family's fat. My brother had open heart surgery for heart disease. My sister had open heart surgery. It has to be genetics. And I'm like, you guys all eat about the same thing. You could take, 2 identical twins separated at birth, raise them on opposite sides of America, and they'd both probably be eating a lousy diet, okay? So it's been shown when they've sort of teased these things out. It's the diet and the lifestyle more so by far than genetics. Genetics are much less important than is widely claimed. Okay, so the person takes a shower. It's in tap water. They're inhaling the chloride, which is a little bit toxic. Then they got the estrogenic chemicals in the water, the F-, the aluminum, all of that stuff. Okay, then they put deodorant on afterwards before they're ready to go to work or wherever they're going that day. Estrogenic perfume cologne, okay. Their clothes are laundry washed in all these phthalates, BPA, and also the water of the washing, and then the dryer squares, if they use them, transdermally absorbed. If they're wearing polyester clothes, more estrogen exposure. And then they'll eat typically a high-fat breakfast, bacon or something stupid with estrogenic chemicals in the animal they're eating. And it'll also be high fat, high sodium. That's going to cause more vasoconstriction, decrease tissue oxygen delivery. Let's see what else. The high meat diet changes the gut bacteria because there's no fiber in meat, very little in processed food. It's the fiber feeds the good gut bacteria. The relevance is when you get the bad gut bacteria, the one from a processed food in the meat diet, they've got more of an enzyme called glucuronidase. Glucuronidase unconjugates estrogen. What that means is when you eat, your body has, let's just say, getting back to your body has extra estrogen that it excretes through the liver. So when the blood levels are high, the extra estrogen goes to the liver. It's conjugated to something called glucuronic acid. Just think of it being like a glucose with a carboxylic acid attached to it. And that goes into your bile, which then goes down through your bile duct into your intestine, and you defecate it out of your body. That's how you lower your estrogen levels. But when you don't eat dietary fiber, you get more and more of these bacteria that have high glucuronidase enzyme, which cuts the bond between the estrogen and the glucuronic acid. And when that happens, the estrogen gets reabsorbed into our body. So estrogen levels go up. These other bad health habits, I'm not going to get in those. Other bad health habits. I'm going to focus on estrogen right now for the moment. Female takes a birth control, EE2, typically a phenylestradiol, that's estrogenic. New car smell and plastics, estrogenic sunscreen chemicals. These are all transdermally absorbed and estrogenic. Also, a lot of people, they're putting their cell phone in their front pocket. Guys are microwaving their balls, and that's going to lower their sperm counts, lower their testosterone levels. They're sitting with a laptop on their lap. Not good for the male or the female gonads. A lot of women put their cell phone in their front pocket, and it's a low-power microwave transmitter on their breast, increasing the risk of breast cancer if they do that for a long time. In their back pocket, I think that's increasing the risk of rectal carcinoma. Not a smart thing. You should put that farther away from your body, like in a backpack or in your purse or something. I talked about the bottled water having estrogenic chemicals, these energy bars. Okay, well, they're usually going to have MFG and stuff. They can have estrogenic food dyes in them, and sweets can. High fructose corn syrup is sprayed with atrazine. The soy is got glyphosate on it. The soy is intrinsically estrogenic. For lunch, okay, these are excitotoxins. Dinner is the meat. Sometimes they use lavender incense. Sometimes they smoke MJ. All these things are estrogenic. The point I'm trying to make is a typical American exposed to lots of these things, and they just get nickel and dimed and they destroy their health because they're completely ignorant of them. They have no idea what they're doing. Okay, this is just a joke from college. I'll even skip this one. All right. Now here's something you guys should know about. 3 types of cancers. It's been said, the guy who sort of came up with this was George Cryle at the Cleveland Clinic, and Gilbert Welch is sort of associated with it. And the idea of saying there's three types of cancer. Imagine you're a farmer, owns this giant farm. It's like, 100 square miles. And in the center is this animal enclosure. And then on the periphery, there's a fence. And there's 3 types of animals. There's rabbits, turtles, and vultures. Okay. Now, a vulture is a really fast-growing cancer. Once it gets out of the animal enclosure, it quickly flies over the fence, and there's nothing you can do. The patient dies. All right. The thing about vultures is they're super rare. There is such a thing, but there's nothing you can do about them. Okay. They show up in between screening intervals, kill the patient so fast. There's nothing anyone could do. But those are really, 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 really rare. All right. Then the next one is the rabbit. And this is what everybody thinks cancer is. Cancer is a rabbit. It's dug a hole underneath the little central enclosure fence, and now it's making a run for the fence. We got to stop it. We got to stop the rabbit. Do anything you can. Chemo, surgery, radiation, everything, Okay. So what I'm trying to say is the reality is most cancers are turtles. They're very slow growing, and the patient's going to die for something else. So you got to be real careful you don't overdiagnose and overtreat turtles, because the side effects of treating a turtle, like chemo, surgery, etc., are potentially much worse than the turtle itself. So that's important to know. If you should be diagnosed with cancer, do you have a turtle, a rabbit, or a vulture? If you got a vulture, it might be too late already by the time you're diagnosed. It probably is, okay? But they're super, super, super rare. But what I see every day is turtles that people think are rabbits, okay? So watch out for that. And yeah, rabbits do occur, and there are things you can do for them. We're not going to get into all the details of that. A little bit about cancer is cancer divides. That's called the doubling time. And we usually can't even see it on a CAT scan or an MRI until it gets close to around a centimeter. let's say at least, 5 millimeters, you see it, you don't know what it is. Okay. When it starts getting up on a centimeter or bigger, we can detect it on a PET scan, for example, like a fluorodeoxyglucose PET scan. But anyways, by the time it's gotten that big, it quite often will have micrometastases to other locations. It's usually going to be metastatic before you can even diagnose it. And a relatively small tumor can shed cancer cells into the blood. Okay. And it's been around for years. So you don't need to run and get surgery that week. Usually the thing has been there for many years. All right. All right. And then here's another point. A little tiny tumor that weighs about 1 gram can shed over 1 million cancer cells into the blood in one day. So what's the point? Why am I even telling you this? Because the more you understand about cancer, the more it guides your thinking. Given that you could be shedding like 1 million cells in your blood every day, what's going to remove those? First of all, a lot of these cells, they can't find a place to land. They can't find an apartment. They die homeless in the streets. Okay. But what I'm saying is the immune system is what removes them, removes the ones that would otherwise have, found a place to live. So you need a good immune system. That's an important point. Remember that. You need a good immune system. A lot of people don't know that, and they don't let that into their thinking, and they do very stupid things. Okay. Here's the lymphatics in your body. Everybody knows you got arteries. The heart pumps blood into the arteries. The blood then travels through smaller arterioles to capillaries, and it goes into the venules, into the veins, and it returns to the heart. Okay, beautiful. That's your systemic blood flow arterial venous circuit. But guess what? You also have a whole bunch of vessels from your lymphatics. These green things all over your body are your lymphatics. They are not connected to your heart. What do you think pumps them? Your muscles. That's why you want to be exercising. Our ancestors, man, they walked a lot all day long. So you need to walk or get some exercise, some aerobic exercise every day to pump these lymphatics. You can increase the amount of fluid traveling around in those lymphatics 10 to 30 fold by exercising. And that gets your white blood cells to circulate all over your body so they can more effectively remove any of those cancer cells. Because I think everybody has cancer. It's just that for some people it becomes symptomatic. For others, it's under control by the immune system. All right, a little bit about this is some of the work of Thomas Seyfried. He did some really good research on the concept of cancer as a metabolic disease. There's two main theories of cancer causation. There's obviously some chemicals that are highly toxic, but what I'm saying is this basic idea I'm about to tell you is fundamental to having a good understanding of cancer. Conventional thinking on cancer was based primarily on what's called the SMT, somatic mutation theory. That's been largely disproven. Yeah, there are some cases where it seems relevant, but it's totally overrated. You need to know that, okay? Like the Genome Atlas project, really, they couldn't find consistent patterns of mutations, and that really changed how people think about cancer. It was the metabolic theory of cancer has been around for a long time. Otto Warburg, won the Nobel Prize, I think it was in 1931, and he figured that if you deprive cells of oxygen, you'll often transform some of them into cancer. A lot of them just die, but you can transform them into cancer where they start to behave like an anaerobic bacteria. And this is some of Seyfried's work. Basically, a normal cell divides into, 2 daughter cells. All right. A cancer cell will divide into 2 cancer cells. But what they found is if you have a normal cell, mitochondria, and cytoplasm, even if you change the DNA, the cell doesn't get cancer. So it's not sitting in the nucleus. This is an important point. The DNA, most of the cell's DNA is sitting in that nucleus. Versus if you have abnormal mitochondria and cytoplasm from a cancer cell, the progeny will be cancerous. And this is consistent with the metabolic theory of cancer, meaning that what's causing the cancer is related to the cytoplasm and the mitochondria and not to the cell's DNA. Okay, here's the 3 main phases of cancer. There is the initiation, some type of injury. Okay, the metabolic theory of cancer, MTC, metabolic theory of cancer, emphasizes lack of oxygen, hypoxia. Okay, and this, trust me, this is super useful to know this. Like one of the most important things you can know about cancer. Otto Warburg theory, Otto Warburg effect, due to hypoxia, metabolic theory of cancer, the bacteria transforms itself to behaving like an anaerobic bacteria, meaning a bacteria that can survive without oxygen. Somatic mutation theory says mutagenic chemical or virus injures the DNA, and that causes the cell to then become cancerous. But the point I just made with that last slide was the DNA injury is usually not the causative thing. That seldom seems to be the money on what's causing cancer, whereas this routinely seems to be the main cause of cancer. It's a really important point to get. Okay, here's animal protein. That's a major tumor promoter. And as a matter of fact, T. Colin Campbell says that's the most powerful tumor promoter on earth. And this is where the money is, by the way, tumor promotion. This is where you win or lose the game with cancer. And so you want to avoid all the things that increase cancer growth. So if you got an estrogen affected cancer, you want to minimize your exposure to estrogen and estrogenic chemicals. And this is where you have a chance to make a giant difference. You also want to avoid things that activate mTOR, mammalian target rapamycin. That's sort of the growth nutrient sensing pathway that tells cells to grow. If you minimize certain nutrients that tend to be rate limiting steps for cell replication, you can slow down the rate at which a cancer grows. That's thought that is doable. Okay, so meat tends to be full of these things. High in iron, high in fat, sat fat, cause a big elevation in insulin-like growth factor, activates mTOR. It's got more leucine, it's got more methionine, more lysine than a lot of plant foods. Okay, having a suppressed immune system, like due to excessive psychological stress, corticosteroid medications, a lot of caffeine, sleep deprivation, those will also weaken the immune system's ability to remove potentially metastasizing cancer cells. So this is where the game of cancer is won or lost. This is where the battle is fought. You need to know this. If I had cancer, I would optimize all this stuff. I already optimize all this stuff because I don't ever want to get cancer, or at least never get a symptomatic one. But I'm just telling you, this is the money. If you want to study one thing about cancer, you want to study this. Okay, further advanced cancer will then start to spread through the lymph node system, potentially through the blood, hematogenous mets. These are things that contribute to it. And there's sort of two phases of life. And what you want to do is spend more time in the maintenance phase. Americans tend to spend too much time in the growth phase. So mTOR is like a contractor getting ready to build a building. And before a contractor builds a building, it wants to make sure he's got all the building materials. Well, the building materials are having adequate amounts of fat, adequate amounts of iron, and having adequate amounts of amino acids, especially leucine, for example, the branched chain amino acids, and also methionine. So meat has a lot more of that, and it increases the likelihood that mTOR is going to be activated, tell the cell to replicate. Because if you stop a cell from replicating, you stop it from growing. That's what you want to do. Being sedentary also tends to lead to having high energy levels, high amounts of nutrients available in the cells. Versus if you're exercising, you're getting your lymphatic flow to be better, so your immune systems are functioning better. They're traveling around your body. You're also activating what is called the AMPK pathway, and what that's all about is that's the opposite of mTOR. That says, okay, the body is a little bit energy depleted. We just exercise. We need to rebuild ourselves, so to speak. Our individual cells need to replenish their ATP storage levels, adenosine triphosphate. That's sort of like the equivalent of a $20 bill inside a cell. It's the energy currency. We use ATP for tons and tons of chemical reactions in our body. Our mitochondria are the main site where ATP is made. You'll also do something called autophagy, which basically means you try to make everything more efficient. You go, okay, we're kind of running low on energy. We need to make this cell more efficient. Let's get rid of our non-functional proteins. Let's get rid of our non-functional mitochondria, and you get mitochondrial biogenesis, meaning let's make new mitochondria that function effectively. So even though our food sources are a little bit limited compared to what we want to do, our mitochondria will function more effectively, and we're going to be okay. Okay, so you get your sleep and all the good stuff. When you're asleep, your rest, your stress levels under control, etc. Having a sense of purpose in your life, being religious, having an attitude of gratitude, all those things make you healthier. Okay, so here's metabolism in a cell. Let's say glucose comes into a cell, undergoes glycolysis. In a cancer cell, a lot more is going on to lactate. But normally, pyruvate's going into the mitochondria. You're going to then use that to produce energy. But one of the reasons why I'm showing this slide is glutamine is an amino acid, very abundant, can come in the back door, and it can supply intermediates for Krebs cycle. That's relevant because people are going to say, well, what about the keto diet for cancer treatment? In my opinion, based on my study of the physiology, I don't think that's a good idea, okay? Because I think you're going to end up with problems with glutamine, is my impression. Okay, a little bit more about cancer physiology. So let's say here's an anaerobic bacteria. It just takes glucose, runs it through glycolysis, pyruvate's converted to lactate, all right, like a waste product. In a normal human cell, most of your energy, ATP, is made in the mitochondria. Okay, you're going to blow off CO2. This is called oxidative metabolism, meaning metabolism with oxygen. In a cancer cell, the mitochondria have been injured by that hypoxia we kind of mentioned earlier. And with an injured mitochondria, you can't make much ATP. So you're going to start becoming like this bacteria that runs anaerobic without oxygen. And as you run the glucose to pyruvate, you're then going to expel the lactate. You're also going to expel protons at that time. It's going to cause the extracellular matrix to become more acidic because you're expelling protons. And the relevance of that is that cancer likes to live in what is called an acidotic milieu, meaning acid around it. This is another benefit of plant foods. Plant foods are relatively alkaline, basic. And so you want that. You want to create a milieu which favors normal cells over the cancer cells. Okay, and this is, again, when I was talking about glutamine coming in the back door, and it can run Krebs cycle. All right, you get upgrades in the cancer cell. They're going to have more insulin-like growth factor receptors, so they're going to be more hypersensitive to the protein that's available and its related growth factors. They're going to have more iron uptake receptors. They're going to have more fat uptake receptors, CD36s. A big thing that changes with a cancer cell is they get more of what is called hexokinase 2, and that's part of glycolysis, and that enzyme will sit right on the mitochondria, and it prevents the cell from going into apoptosis. It helps to make the cell immortal, and this is a very common change in the physiology of cancer cells. So I'm telling you these things because if you study cancer more, you'll see I'm hitting on the key points, and I'm also explaining why the metabolic theory of cancer is so powerful. The reason it's powerful is it tells you what causes cancer, and it tells you what you could do. That's useful. If somebody just tell you, well, you got bad genetics and you're exposed to a toxin many years ago, there's nothing you can do except go for surgery and go for chemo. That limits your options. Sometimes that might be the right thing to do, but that certainly limits your options. Okay, a normal cell is mostly a worker. Okay, a normal cell is like a manual laborer. So it needs a lot of energy to do work all day long. Okay, a cancer cell doesn't really care too much about working. A cancer cell is a freeloader. A cancer cell is more like a cell that says, take this job and shove it. I just want to grow. And so it takes its nutrients that come into it, and instead of using those to make energy, it mostly uses them for synthesis. It has to make a lot of protein, a lot of nucleic acids, DNA, for example, in order to replicate itself. All right, so here's what a mitochondria looks like. It has an outer mitochondrial membrane, OMM, an intramembranous space, IMS, an inner mitochondrial membrane, IMM, and inside the mitochondria is the matrix. You're going to hear a lot about mitochondria because that's where most of our energy is made. Okay, a mitochondria is kind of like a fireman bucket brigade. Electrons are passed down from complex to complex, and simultaneously that energy of passing them down like a snowball rolling down a hill is used to pump protons out into this intermembranous space between the outer membrane and inner membrane. And then this gradient of protons that have accumulated in intermembranous space is harvested, and as the protons brought back into the mitochondria, the center of the matrix, you can then couple that, spin this enzyme, ATP synthase, to make an ATP. You add a phosphate to an ADP, adenosine diphosphate. And that's how energy is made. That's life on Earth right there. This is the inner mitochondrial membrane, and that is how it creates a proton gradient, which is subsequently harvested to generate the energy to produce ATP. That's life on Earth. Okay, over time, if a person's diabetic, they'll get thickening of this capillary basement membrane. Here's a capillary. Red blood cells are passing through the capillary. These are the smooth muscle cells, vascular smooth muscle cells around a small artery, arteriole. The blue circles are the oxygen going to the tissue. Here it is, a neuron in your brain. And what I'm saying is if you're chronically diabetic, chronically hypertensive, diabetes will give you thickening of the capillary basement membrane. Hypertension will get thickening of the vascular smooth muscle. You also get collagen laid down in these areas. And it's all going to decrease the amount of oxygen goes through tissue. So what I'm saying is you're going to have a synergistic effect of worsening diabetes and hypertension, leading to tissue hypoxia, leading to the Warburg effect, oxygen deprivation of cells causing cancer. And then if you throw on top of that a growth factor like estrogen, you big time ramp up your cancer risk. Okay, ketone bodies, like I said, I'm not going to get into all the physiology of it, but believe me, I looked at the physiology, the biochemistry of it. I think it sounds like a bad idea. Cancer does a lot of bad stuff. We're not going to get into all that stuff, but the bottom line is cancer cells sort of hang out in their little cancer tumor growth center, and they are pumping out acid around their periphery, which sort of paralyzes the immune system. They also like it kind of hypoxic. It favors the cancer cells over the normal cells. So you want to be as healthy as you can, because when you're healthy, that favors the growth of normal cells over the cancer cells, and it helps you to win the game, okay? And so it's been said by a famous scholar of cancer that, are you sick because you have cancer, or do you have cancer because you're sick? And the point being is by being as healthy as you could be, you favor your normal cells over the cancer cells, and you could potentially slow it down a lot. There's been a lot of people who survived metastatic cancer for decades by being super healthy. And And that's what I would do if I had cancer. That's one of the things I would do. This is just a list of some of these estrogenic chemicals. There's tons of them, tons of them. So like I said, the only way to avoid all this stuff as much as possible is to be a minimalist. And so I'm a minimalist. I'm 60 years old. I got good energy. I can concentrate 12 hours in a row. I'm strong. I can do 72 push-ups in a set. And the reason I tell you all that is most people over 60, they're fat, they're sick, they're kind of mentally slow, they're weak, they're kind of pathetic. They go to their doctor, get a bunch of pills. You don't have to be that way, okay? And these other sort of more rural societies, the Blue Zones and National Geographic and Dan Buettner, you got people in their hundreds doing push-ups, okay? What do estrogens do? Well, estrogens tell the woman to gain more weight, to store that as energy for the baby. They activate something called the PPAR gamma fat switch, if you will, if you want to call that. So estrogens tend to be obesogenic, promoting weight gain, obesity. They also promote proliferation of breast tissue, especially, let's say, during puberty, breast development, thelarc. Let's see, what else? Excessive estrogens, of course, are like a woman who's pregnant, and they'll impair ovulation, and they can lead to infertility. If you want to read more about estrogen, this is the best book ever written on the subject. I've read a bunch of books on estrogen chemistry. Estrogeneration by Anthony J. It's a great book. It's on one of my all-time favorite medical books. It's very funny. It's very clever. He's a PhD biochemistry. He did a lot of his specialization in lipids, and he did a fantastic job. This lady, Philippa Darbra, she has done a lot of great research. She's pretty famous. So that's good. Neil Bernard, he's pretty knowledgeable about estrogen chemistry as well. But her textbook is pretty good. This book's the best, though. It's the best book by a factor of 10. It's 10 times better than the other books. Estrogeneration. So what I'm saying is, if you want to read a book, that's the book to read. You don't need to read a book. I mean, I'm telling you what you need to know. There's always more to every subject in biology and health and nutrition and medicine, but I'm telling you what you need to know, how to avoid these things. Okay, main estrogen is estradiol. Di means two, and there's two hydroxyl groups, also sometimes called alcohol groups. There's a couple different estrogens. So let's see, what's the point? Oh, estrogenic chemicals in processed food, because people sometimes say, well, the estrogens in these plant foods, they're kind of weak estrogens in comparison with our normal estrogen hormones. And sometimes that is certainly true. But when you're eating thousands of times more than them compared to little tiny quantities, in the body, like we're talking picograms, okay? A person can eat many thousands of times more than that in their diet if they're eating a bad diet. And they can overactivate their estrogen receptors. Let's see. Whatever problem a woman has with female type problems, or worse with abnormally high estrogen levels quite often. These are all some of the side effects they can get. Let's see. These are just some of the things associated with high estrogen levels. Morning sickness, postpartum depression, hypothyroidism. Soy makes that worse as well. F- could potentially contribute to that as well. Having leaky gut, you get the autoimmune diseases like Hashimoto's thyroiditis and Graves' thyrotoxicosis. Increased fibrocystic disease in the breast as well as breast cancer. There's the Mets there, and the axillary lymph nodes. Endometriosis, fibroid tumors, endometrial uterine cancer, long abnormal menstrual bleeding. All right, anyways, and the child can have deformity of the penis called hypospadia. All right, and you get a vicious cycle going. The woman gets fatter, the fat tissue converts more testosterone to estrogen, and so to get this cycle going, she just gets fatter and fatter and more diabetic and takes diabetic pills that make her gain weight. So what you want to do is break the cycle. How do you break the cycle? You go low fat, low protein, low sodium, 100% vegan. All right, here's a structure of our bodily estrogens. First of all, they're on a cholesterol backbone. All the steroid hormones are on this type of backbone. There's 4 rings, A, B, C, and D ring. The A ring is uniquely aromatic in an estrogen chemical of our body. Our intrinsic estrogens, our endogenous estrogens. Aromatic ring is also called a benzene. It's got 3 double bonds that resonate amongst these carbons, and that makes it very stable for a long shelf life. Here's the hydroxyl group, also called an alcohol group attached to the aromatic ring, and that makes it antimicrobial. So again, this is the perfect industrial chemical. Good shelf life and antimicrobial, antifungal. So it's in everything. All right, here's how estrogen affects the receptor. It'll form a hydrogen bond with the active site of estrogen receptor. So here's the 4 rings, and here's the hydroxyl group, and there's the hydrogen bond formed with the side chain there. on the receptor, and that will activate it. So anything that's got this phenol ring can activate this estrogen receptor. So a lot of things can do that. It's very easy to make those molecules. Here's bisphenol A. This is what I meant by you got a phenol group here, phenol group here. So bis means 2. But then you just have, 3 carbons in the center. Well, guess what? People complain about BPA. Company goes, okay, fine. They just put a sulfur in the middle, and you still have the same effect. So instead of BPA, you got BPS. And that's why you could never, through regulation, remove these chemicals. Okay, here's a scoop. We talked about this earlier. When you your body tries to get rid of estrogen by conjugating in the liver. So estrogen, high estrogen levels, estrogen comes into the liver. The body puts a glucuronic acid on there. Okay, this is E for estrogen. This is a glucuronic acid. All right. Then it excretes that. The liver does into the bile. The gallbladder would be right here. I didn't draw the gallbladder in this picture, but excretes it into the bile. The bile then drains into the small intestine, the duodenum, travels along our intestinal tract to the colon. And normally we should defecate it out of our body to lower our estrogen levels. But when you eat low fiber diets where you got a lot of meat and processed food, you get more of these bad gut bacteria, and they've got more of this enzyme, glucuronidase, and that cuts the connection between the estrogen molecule and the glucuronic acid. And now when the estrogen is free, it gets absorbed into our blood. It gets absorbed through our intestinal lining into our blood, travels around our body, and has estrogenic effects. So that's why you want to make sure you get enough dietary fiber, because it does all kinds of good things. It prevents these bacteria with a lot of glucuronidase enzyme. It also maintains the tight junction in your intestinal layer so you don't get leaky gut and all these autoimmune diseases. Okay, we already talked about that. Did I have doubles on those slides? Okay, deodorants and breast cancer, upper outer quadrant used to be 30%. Now it's 60% of cancers. Okay, we pretty much covered that. How they shave their armpits, they get more transdermal absorption. So you don't need estrogen. So a lot of women say, well, I got an aluminum-free deodorant. Well, that aluminum-free still probably got estrogenic preservatives. Just get over it. You don't need deodorant. That would be my advice. I mean, you can do whatever you want, but I would just say the smart thing is forget about it and save your money and save your time. Okay, triclosan is a common estrogenic chemical in a lot of soaps and toothpaste and whatnot. And like I said, shampoos tend to have a whole bunch of estrogenics. Even a baby shampoo will often have at least 2 of them in there. I would not overuse cleaning chemicals, conditioners, toothpaste, mouthwash. All this stuff is bad for you. Okay, cleaning chemicals. For example, nonylphenol, like we're talking about laundry detergent. You'll have this right here, a phenol with the aromatic ring and the hydroxy group, and then you just have this hydrocarbon chain. That sort of, it's this part's polar, this part's nonpolar. But the bottom line, like an emulsifier, being amphiphilic, these can function as detergents. So what I'm saying is all these things have an estrogenic effect. So that's why you want to minimize your exposure to all this stuff. So I avoid all unnecessary personal care products. I don't use them. If I can avoid them, I don't use them. I don't use anything unless I have to. I don't like all this stuff. Here's what I meant about parabenzoic acid. So what that's all about is, let's say you have an aromatic ring here, and you got a phenol with a hydroxyl group right here. The position relative to this phenol, if these are at opposite ends, that's called a power position. Here it looks like ortho. Ortho is called O for the I position. And you imagine you had an I right here and right here. Meta would be they're down at this location and look like a mustache. I just made this. You don't need to know this. All you need to know is parabenzoic acid is estrogenic. So it's benzoic because you got carboxylic acid up here on a benzene ring. And this is a super common preservative. You'll often see things say no parabens. They're telling you they don't have these estrogenic preservatives. But like I said, they'll have some other estrogenic preservative quite often. Marijuana is also estrogenic. And marijuana smoking is stupid. You shouldn't be doing that. It's toxic to your brain. It's toxic to your endocrine system, your hormonal system, your estrogen system. And there's nothing smart about it. In my experience, marijuana users are some of the stupidest people I know. And the bizarre thing about them is they think they're clever, but they're stupid. They're sort of, I avoid them to the extent that I can. Marijuana is toxic to the human body. I've seen it cause schizophrenic breakdowns. I've seen it be laced with other chemicals like PCP and cause major neurologic damage. It's a poison. You should stay away from it. Okay, lavender, used to wash, like lavar, the sort of Latin word to wash in Spanish. Let's see. So that was a a neurotoxin for the Romans, and some people think it's a good thing. It's not a good thing. Want to avoid that. Watch out for old, moldy grains, wheats, corn, soybeans. Going to get mold in them if they're too old. So that's something you want to be a little bit careful about. Okay, estrogenic and sunscreen. I don't even use sunscreen. I just go outside for the amount of time I need to get my vitamin D, maybe a little suntan, and I leave it at that. A lot of these chemicals in sunscreens are associated with increased risk of hypothyroidism, an estrogenic effect. They often use nanoparticles on them, so-called impact enhancer. It's all toxic stuff, okay? And if you talk to a dermatologist, they'll tell you, oh, you need sunscreen. Well, they don't know much about the chemicals, okay? They're sort of just trained to say that. Here's benzophenone. These are just some of the typical estrogenic chemicals in sunscreen. And they do get transdermally absorbed. And like I said, there are often nanoparticles mixed in, and who knows the long-term sequela of that. So, you know, you look at the guys who cut lawns, okay? They're wearing, you know, sombreros and long sleeve shirts. You don't want to be absorbing this stuff. I don't know how much of these transdermal nanoparticles are absorbed. I don't know if they're crossing the blood-brain barrier and they're toxic. I have a friend who's a nuclear medicine physician, and I asked him, would you be worried about it? And he goes, yeah, I would be worried about it. He's worried about it. He says, we don't exactly know what's happening there, and it's potentially significantly damaging. So I don't want to rub nanoparticles on my body. That means really small particles. Red number 40 can be associated with all these dyes. Often have these names that are just euphemism. Okay, this is a complex organic chemical. So calling it red number 40 or red number 3, they're not good for your health. We talked about your drinking water. Get at least a carbon filter. Try to ideally have a carbon filter for your whole house, but definitely for your drinking water. You can put one on your shower. I think that's a wise thing to do. And like I said, notice municipality, they don't bother to remove all this stuff. They sort of feel responsible to prevent infections, but that's not much more than that. Okay, we talked about the 8 cups a day being a whole stupid joke. And if you're drinking unfiltered water, you know, there's toxic stuff in that water, those 8 cups. Let's see. Oh, this was that work of Tyrone Hayes showing that the atrazine was sprayed on the corn. It's also sprayed on some golf courses and stuff, sometimes on lawns. It's quite estrogenic, and it feminized the male frogs and turned them into females. Okay, these are 2 in the same litter, brothers that are doing that because of their estrogenic effects. This is also mitochondria. The atrazine is a mitochondria inhibitor. It has an inhibitory effect upon complex 1 and complex 3. So that's really bad. Anything that's toxic to your mitochondria is really bad, because you need your mitochondria to make ATP, especially your inner mitochondrial membrane. And when that's damaged, that means they're also going to have a neurotoxic effect. There's even a famous researcher of endocrine chemicals. I think his name was Gil Sertolini. And he said that most of these estrogenic chemicals are also neurotoxic. Okay, so they not only, you know, feminize you, push you towards being fat and sick, they also push you towards being stupid. That's why avoidance is the best thing. And I mean, people got to watch out for too. Everybody loves their dogs. Well, the dog's running around in the grass sprayed with who knows what, maybe atrazine. And then if you let that dog in your bed, then you're putting those chemicals on your bed. So I'll let you use your judgment on that. Normal testosterone is not just the testosterone levels. They can also, the endocrine disrupting chemicals, EDCs, can downregulate your testosterone receptors. So that's going to have a major effect, decrease in testosterone effect, almost like a castration effect. Let's see, how to lower estrogen levels. Like I said, be a minimalist. Don't put stuff on yourself if you don't need to do it. Let's see, substitute products that are less, and that's sort of Anthony J sometimes recommends that. My opinion is just avoid stuff. For example, I don't use shampoo anymore. Now, you know, I don't have that much hair. I'm bald on top. So I, you know, maybe if a woman's got real long hair, she maybe needs shampoo, but try not using any shampoo for a while. You'll be amazed. Once I stopped using it, I didn't miss it at all. And I never use conditioner. We talked about avoiding deodorant, dishwasher detergent, laundry detergent. Minimize use of cleaning chemicals to what's necessary. You can avoid things like sunscreen. Go real easy on the cosmetics. Try to avoid them to the extent you can. avoid plastics to the extent you can. For example, if you have a water bottle you carry to work or something, use glass. Let's see, put your food in wax paper. If you get a submarine sandwich at the deli or something, don't put it in aluminum foil. You don't want aluminum getting any food. That's a metalloestrogen. Let your car outgas in the summertime so the car seats, don't smell that stuff, those plastics. All right. Oh, this is just my bathroom. In my bathroom, I have, some friends who will lift weights and they sometimes use the soap. I don't use anything except the little transparent bar soap. I have nothing in the shower. This is my old house too. This is when I had to take my neuroradiology boards, my CIQ specialty boards. I used to tape all these pictures to the wall. I got a perfect score on my boards. Okay. I found this helpful. I actually called this the magic bathroom. I would always have some book here, often a textbook on this little portable table when I was doing a number 2, and I'd have paperbacks right here I was doing a number 1, and I had a audio CD player to listen to books when I was walking around or anything. And then I would always see the key pictures here, anatomical reasons. What I'm trying to say is, anybody want to be a good student, want to memorize something, learn it fast? I put pictures of some of my heroes on the wall. This is just a way to do it. But the point of showing you the bathroom was, in comparison, my wife's bathroom, she's got like 55 cosmetic products. She was a cosmetologist before she became a doctor. And so, like I said to her, you don't even know what's in these things. You're rubbing some of these toxic chemicals on yourself. She's like, you don't understand. A woman would rub SHIT on her face if she thought it would make her pretty. And I'm like, well, that's what you're doing. And then she goes, well, you're just jealous because you're aging fast. You have a lot of wrinkles. Look at your forehead, right between your eyebrows. You have a big bitch line. I think you need Botox. So she's just sort of like shifting the conversation, but I'm obviously right. Oh, I just showed this a picture of me when I was in college. And I just show you this picture because I see a lot of young guys. They're frustrated because they can't get stronger in the gym. They're lifting weights. And I tell them, your problem isn't the weights. Your problem is they got a cell phone in their front pocket, microwaving their balls. That's why they're not getting stronger. And they've been so feminized by all these chemicals. I can tell you, back in the old days, we never wore bracelets. All these guys are wearing bracelets. Then they've got earrings. And I'm like, they're very feminized. And I don't think that's by accident. I think society has been feminized sort of like to weaken people. I'm sorry, but things are way different than they were when I was a young guy. Okay. Soy has an anti-thyroid effect, a goitrogenic effect. Just tell you a little bit more about this. It's been shown to induce goiter. There's all this negative research on soy that came out before the modern, rich companies produce all this industry-funded stuff that supports their product. And some of these products associated with increased breast cancer, because a lot of people say, oh, no, I read that soy prevents breast cancer. I'm like, read some of the older papers, okay? 2001, this paper here. Increased insulin-like growth factor, which is associated with cancer. Another one saying the increased risk of cancer. And here was a paper, a Mueller paper, where people say, oh, soy only affects the good estrogen receptor, not the bad estrogen receptor. No, it affects both of them quite a bit. Okay, so I think that's a misinterpretation of the data. And I tell you that because you could also be ingesting these phytoestrogen chemicals in very high amounts. I avoid them. I avoid soy. I think it's for chumps. I think it's a good way to sterilize low IQ chumps. Okay, it also increases insulin-like growth factor. It also has some heme, unlike other plants, and it also is often sprayed with GP, glyphosate, etc. Here's a paper coming from MGA. It's Massachusetts General Hospital, which jokingly is called man's greatest hospital. It's a Harvard-affiliated hospital. And they were showing that it had a rather dramatic lowering of sperm counts in men, okay? Soy food and isoflavone intake in relation to sperm quality in men in infertility clinic, okay? 41 million fewer sperm per milliliter, okay? That's what I mean by it's a way to sterilize chumps. Okay, precocious Filarc, soy given to young girls increased their precocious breast formation, Filarc. Okay, so that's what I'm trying to say is I think people are being sold big lie, BS, trying to tell them that soy is safe. I don't think it is, and I don't think it's a coincidence that it's subsidized. Gee, it's a big coincidence, the subsidized stuff, soy and atrazine sprayed on corn and aluminum in your water causes infertility. The really rich people of the world, you think they like all the population that they see? No, they think that all these people are basically polluting the world and messing it up, and they wish you were infertile, okay? So if you want to have babies, you better protect your fertility, because if you just go along and not thinking about it, you're probably going to lose it like a chump. Okay, let's see. More papers on premature abnormal development. Flax is also real high in estrogen. I don't have time to go into the details on flax, but I avoid that stuff too. It's really high in estrogenic chemicals, even more than soy is. Soy is just more commonly talked about. And if you compare it to beans, there's hardly any in the other beans, okay? Let's see, what else? The plastic bottles. In the plastic bottles, they dissolve, especially if the product has any oil in it. So let's say you have an oily sunscreen or moisturizer. It's in a plastic BPA phthalate bottle. That plastic is leaching into the lipid-containing substance, personal care product. I don't use any of those personal care products, okay? Let's see. It used to be the old Rodney Dangerfield joke. There's a fine line between rubbing something on your skin or rubbing yourself with it. I screwed up the joke, but I think you understand what I'm saying. Let me go back to that previous slide. What was that? Conflicting data on breast cancer. There's one study showing it increases the risk of breast cancer. I just tell you that because other people are going to say, oh, it lowers the risk. I'm not so sure. It can also interfere with the function of tamoxifen. Let's see. Okay, enough about that. Oh, it also interferes with the development of the reproductive tract. This is in rodents, but, to me, I don't need any more information. It's sort of like if for me to want something this estrogenic, it would have to do my laundry, please me in bed. Okay, why would anybody want all these problems for nothing? Okay, disrupting the reproductive tract function. You don't think that's going to affect fertility? Okay, here's soy formula in this one mouse study. Change the development of the vaginal epithelium of the uterus size, the breast development, led to heavier menstruation, increased risk of endometriosis, probable increase in fertility, increased risk of uterine cancer in mice by 35%. I'm just saying, it's like, who needs all these problems? Okay, risk of infertility. So I'm saying is you'll find plenty of problems when you start reading it. You'll be amazed because you'll have never heard all this stuff before. We already talked about some of those papers. The non-organic stuff's got a lot more problems. Let's see. Oh, the populations where they would eat some, like in Asia, they would eat very small amounts grown locally, and I think it was counteracted by the healthy plant-based diet that they otherwise ate with all the rice and the vegetables. And like I said, it activates both receptors. It's goitrogenic. Let's see. Increases insulin-like growth factor, which can potentially increase cancer risk. It's real high in fat, potentially can be obesogenic. Activates both estrogen receptors. Associated with increased risk of infertility in men. Dramatic drop in sperm counts. Developmental issues given to a young person in the woman's reproductive tract. It also contains heme iron, which I don't like, which could potentially increase the amount of mTOR activation. We talked about glyphosate. It's also processed routinely with hexane, which is a neurotoxin. Stay away from all that stuff. Oh, here's stuff about baby formula. Baby formulas are toxic. We're not going to go into it. You'll hear some people sometimes say, like this lady, I actually like her. I think she's a good doctor, but I think she is, in my opinion, I think she was lazy in her study of this paper. She quotes a paper that says, oh, soy is not estrogenic. It doesn't affect thyroid, all these things. Who do you think wrote the paper? The guy who, he works for the Soy Institute. So in my opinion, that would increase the risk of that paper being biased, okay? Let's see, what else? Okay, I'm not going to go into all these papers. It's a little bit boring, but here's what I think is one of the big secrets too: how you can take any food and make it look good. If you compare a food to something where there's a lot of problems, so you can get really unhealthy meat and compare it to somebody who eats soy versus the meat, and they'll go, gee, the soy, they're doing better than these patients. Yeah, but look what you're comparing it to. If you compare it to a low-fat, plant-based diet, you're going to be much better off. And like I said, anything industry funded, you got to suspect that it's potentially biased. They found that, like this one article talking about scientific papers, they found that 75% of papers were not reproducible. Okay, that's a huge percentage. That means more often than not. So you don't want to trust the first paper, especially papers in the old days, let's say before 1980, 1985, tended to be more accurate and reliable. People were trying to understand things, whereas a lot of the literature nowadays in nutrition and health and medicine, it's just funded by companies to promote their products. Okay, here's a nice quote from Ayn Rand. If you think there is a contradiction, then recheck your premises. Contradictions do not exist. Whenever you think you are facing a contradiction, check your premises and you will find that one of them is wrong. And that's a very useful way to think, okay? Because when you do that, you'll start seeing, how could something be this estrogenic, affect alpha and beta receptors and not, have an effect on the breast or the reproductive system. Okay. All right. So I kind of talked about it already. It's got high fat. It's got all these other problems. So those are reasons why I'm not a fan of soy. And also I told you about Sertolini. This isn't Sertolini's paper, but he pointed out most of these estrogen things, they're not just obesogenic and estrogenic. They're also neurotoxic. So I would avoid all of them. And that's basically what I got for slides.
Well, thank you very much for that, Dr. Rogers. That was a lot of great information. And I'm going to look and see about the questions that we have that came in. You covered soy because we had someone that asked a question about that. So you covered that. Let's just see. Carrie wanted to know, what does Dr. Rogers think about immunotherapy? My mom is going through it.
Well, you have to be careful. I mean, what's she getting immunotherapy for? Probably for a cancer of some sort. And so what I'm trying to say is, what happens is, because doctors aren't trained in nutrition, epidemiology, and toxicology, as far as they're concerned, those things are irrelevant. They are not treatment options. They're not even aware of them. It's not even on their radar. It doesn't even come into their mind. Okay, well, once you give up nutrition, epidemiology, and toxicology, what's left? All you've got is drugs, surgery, and radiation. So they're always going to treat with some form of a drug, a surgery, or a radiation. Now, there might be some cancers. There are some cancers where they tend to respond well to those things. But the problem is, when all you've got is a hammer, everything looks like a nail. And what I mean by that is, even if they don't have anything, there's an attitude in conventional medicine. Well, the patient's got cancer. They're going to die anyways. Might as well give this a try. They pretty routinely will ask the patient, well, we don't have any good protocols, but, would you like to enter a clinical trial? And I would never go into any of those things, because to me, it's obvious. You're going to get the side effects of the chemo or whatever the new drug is. If there's no proven benefit, then most likely you're going to get side effects with no benefit. That's stupid. Okay. So I would want to know what the results are. And then what's typically going to happen, initially, there's going to be a couple of industry-funded studies. Every new drug, it's always going to have the industry-funded publicity behind it. And then usually it takes about, 20 years, sometimes 30 years before it becomes really clear if that drug is safe. So the way the patients are sold on things, they go, oh, this is a new thing and it did really well in the initial studies, the initial clinical trial. We think it's worth giving a try. And the patient's like, okay. They don't know any better. But what I'm saying is, I would study. Like, let's say I was diagnosed with cancer. I would read all about that cancer. I read all about the treatment options, what they were, what are the pros and cons. And then I would be aware of all the other stuff, like, read Radical Remissions. I think her name is Kelly Turner, wrote that. Read about these people who survived metastatic cancer for 20, 30 years. And a lot of them have written books. And you'll see, what did they do? And almost all of them, what did they do? They went low fat, low sodium, low protein, 100% vegan, 100% organic. They did everything they could to minimize their stress, have an attitude of gratitude. They're religious. They get their sleep. They sort of quite often, and they do all these things to optimize their immune system function. Quite often they'll exercise a lot. There's an interesting lady by the name of Janet Murray Wakelin. She wrote a book called Raw Can Cure Cancer. She actually refused chemotherapy, and then she ran marathons, and her husband was a marathon runner too. And they ran 365 marathons in a year. They ran a marathon every day around the perimeter of Australia. Okay, the reason I tell you all that is, a normal person can't run a marathon, and yet alone if they ran a marathon, they'd be sore for a month, all right? She ran a new one each day because you get much more rapid recovery when you're eating plant foods. And what I'm saying is, you minimize activation of mTOR. You minimize insulin-like growth factor. You optimize tissue oxygenation. You keep your blood alkaline. You're doing everything you could do by doing these psychological things to lower your stress level, improve your immune system, and by getting your exercise and by eating in this way. That's what I would do to start. If there was a way you could track your cancer, I would track my cancer. I mean, for example, if you have prostate cancer, you can quite often track it by PSA, prostate-specific antigen in the blood. A lot of other cancers are more difficult to track. You can track them by, for example, getting a follow-up CAT scan or PET scan, but that's a little cumbersome. There's radiation exposure involved. But, see if there is a way to track it. because it's hard for me to say immunotherapy. Maybe it's good for some things, maybe it's not for others, but quite often it's a relatively new treatment. And a lot of times a new treatment, nobody really knows yet if they're good or not. Okay. But it's sort of a patient attitude that, I'm going to go to the expert and the expert knows what to do. But I'm going to tell you, sometimes they do, but a lot of times experts, all they know is their one thing for their specialty. So, I trust myself. Most people are not like that. Most people don't trust themselves. They say, I'm an ignoramus. I have to do whatever my doctor says. But I would ask the doctor, what are your results? Can you show me good, reliable information that this is likely to increase the amount of time that I live and that the side effects are not that bad? And quite often they're going to say, we don't know, but this seems to be the way to go. This is the standard of care. And if they told me that, I would say, well, then I'm not interested. You don't have to accept their treatment. Don't get me wrong. Sometimes it might be the best thing to do, but a lot of times it's not. Okay. Like when I was young, whenever I see a chemotherapy patient with the bald head, I'd always feel sorry for him and say, oh, this poor patient, going through cancer therapy, how sad. I hope they do well. Nowadays, you know what I think a lot of times? Stupid chump. Okay. Have you read the papers on your chemotherapy? Does that chemotherapy work? Because whether or not it works or not, you're going to get it probably. And if it works, fine. But if it doesn't work, then you're a stupid chump for having accepted it. And you're going to suffer terrible side effects, maybe die sooner in a miserable way, when all you had to do was potentially learn about your cancer. And if there wasn't a good chemo treatment, then do the other thing. Okay. Because you're certainly going to suppress your immune system. What's going to remove the cancer cells long term is a functional immune system. And you're wiping that out. Do you think that's smart? Now, don't get me wrong. It depends on the cancer. It depends on the treatment option. But what I'm saying is, don't just knee-jerk reflexively accept whatever somebody tells you, because it depends on the situation and you really want to have that figured out.
Yeah, it can be very frustrating for those of us that have watched your talks and have adopted this lifestyle, and when we have family and loved ones that are facing these issues and sicknesses, and it's just very frustrating because it's for them most of the time they just want to follow the doctor's recommendations. And some
go
of them
ahead,
are,
have fun, losing your hair and vomiting, being sick and dying early. Have fun. Okay. I mean, if you're stupid, don't get me wrong. Sometimes that might be the right path to go down now, but quite often it's not, because conventional medicine has an attitude. There are no other options except chemo, radiation, and surgery. And therefore the patient's, essentially dead anyways. We might as well give it a try. And what I'm saying is, what I would say to myself is, no, I'm not dead yet. Okay. I'm going to see what I can do. If I've got a way to monitor it, I'm going to do that first. If I'm really getting worse rapidly, maybe I would consider all those other things. If I have a particular type of cancer, which is known to respond well to surgery, chemo, or radiation, then maybe I would go ahead and consider that. But what I can tell you is there's a lot of cancer patients who would be better off if they did nothing. And they'd be best off if they went down this path of optimizing all this stuff based on the literature of all these cancer survivors and radical remissions and stuff. But this is outside of conventional medicine. And conventional medicine is very powerful. In the public mindset, conventional medicine is standard medicine, and they're very impressed by it, even though they never look at the results. Okay. If you look at the so-called, attempts to improve, said they were going to solve cancer back in the 1970s, how much progress have they made? Close to zero. Okay. Cancer rates are going up faster than ever. Tons of people are dying left and right of cancer. Doctors get cancer, and they usually have crappy outcomes. So what I'm saying is, then I look at all these vegan exercisers who minimize their stress and they're religious, and they're living longer, the ones I see. Now, don't get me wrong. I can't provide a study, and these are a whole bunch of anecdotal case reports. And radical remissions lady Kelly Turnell traveled all over the place to interview these people and study them. And so it's a whole bunch of case reports all added up together, anecdotal. But that's what they were doing. And there's reason to believe that works. I've interviewed some of them myself. I've read some of their books, their papers and stuff. I've been impressed by them. So if I had to choose between doing that, where I could trust myself and rely on myself and, die or not die, versus be pumped through a chemo and be guaranteed having awful, terrible side effects, I'd be willing to take my chances. And of course, it depends. There are some cancers that do really well with chemo. There are some cancers that seem to respond well to surgery or radiation. So fine, in that context, fine. But all I'm saying is it would be a carefully, well thought out thing. And there's no need to rush. What I'm saying is the typical stupid patient is like, oh, I got cancer. Oh my God, cut it out. I don't want this in my body. And they go for major, debilitating, awful, big surgery. And then they go, okay, now you need chemo. They're not even fully recovered from the surgery. Chemo, vomit, sick, ball, dead. Okay. And what I would do is I'd say, hold on a sec. I'm going to study this cancer. I'm going to know it really well. How does it respond to chemo, surgery, radiation? What are the outcomes? Is there a way I can track it and monitor it? And then I would make a decision on what to do. And if there wasn't any good option with surgery, chemo, radiation, then I would just do my diet and lifestyle stuff, get my sleep, optimize my immune system, hope for the best. That's what I would do.
Okay, well, thank you for that. So Jay said, Dr. Esselstyn advocates eating ground flax on oatmeal. Every plant-based doctor tells you something different.
Yeah, I have not fully studied flax, but I'm not impressed by it. Okay. The reason I say that is, number one, omega-3s are quite overrated. I studied that subject rather extensively, and the impression I got was that you don't need to supplement it at all. If you're eating a plant-based diet, you're getting plenty of omega-3s, and to seek them out by taking flax seems to me like you're going to increase them more than you want, because all these are PUFAs, polyunsaturated fatty acids. I worry about excessive lipid peroxidation being a toxic thing. Number two, flax is super estrogenic. It's more estrogenic than soy. Okay. My background, I was a college wrestler. Okay. You saw the picture of me. That's what I look like in college. You know, I want to be strong. I like being masculine. Okay. I don't think we have a problem with toxic masculinity in this problem. I think we have a problem with the lack of masculinity in this country. That's why it's going down the tubes. All right. And so what I'm saying is, the last thing in the world I want to do is eat some hyper fat, hyper estrogenic food. Okay. Yeah, it's got some fiber, but it's a very commercial food. I think it's overrated. They have a real strong tendency to lipid peroxidation, rancidities. I would not do that. Okay. Maybe I'll study some more. And yeah, I do like Esselstyn. I think he's great. I think he deserves a Nobel Prize, but I'm not so sure he's right on flax. I've never seen or heard the papers saying flax is so good. And based on what I know about it, I doubt it. And I know it must be frustrating for some people. Yeah, because I do hear a lot of nutrition experts contradicting themselves. And what I would tell you is my theories are pretty simple. I recommend primarily a starch-based and fruit-based to satisfy your hunger. I recommend, some vegetables to get additional nutrients and nitrates. And that's about it. The three simple foods. Those are the only foods that I eat. And I take a vitamin B12 methylcobalamin type. And that's real simple, and it works. And I know it works well for me. Like I said, my numbers in the weightlifting keep going up in the gym. I'm strong, and I know I can concentrate. What I do is as soon as I wake up in the morning, I make myself do whatever I have to do. Like, let's say I have to make a video. Let's say I have to make a book chapter. As soon as I get up, I do it, and I just crank all day. Oh, and the reason I mention that is because I know I talk to lots of young people, and I talk to lots of people my age as well, and they all got all these problems. Oh, I can't concentrate. I'm not motivated. I can't do this. I can't do that. And I'm like, well, here's a system that works. And they're like, oh, well, I can't do that, be a vegan, etc. And I know the people who are half-assed, they have bad outcomes. All these people like, oh, I'm cutting down on meat, I'm cutting down on oil. They're in atrial fibrillation, they're in kidney failure. And the ones who go halfway, I'm cutting down, they usually have bad outcomes. They usually don't get better. The ones who say, yes, I'll do it. No more oil, no more meat, no more of this other bad habit. They usually make dramatic improvements, because if you want to make a change, you have to make a real change. If you're only making these little tiny changes, nothing much is going to happen from it. But yeah, I mean, like I said, flax, super estrogenic and really high in fat and full of PUFAs. Why would I want that? I would avoid that completely. I just eat simple plain oatmeal with water. Organic only too, because if it's not organic, they'll spray GP on it.
Yeah, we've heard a lot about how they're using GP to kill off the plant to make it easier to harvest. So they'll spray the whole plant down when it's ready to harvest, and then it just makes it so much easier to pick up a dead plant and then turn it into oats or what have you. So yeah, that's very important to know. Marcy said, Dr. Rogers, I'm interested in learning more about the interplay between estrogen and insulin sensitivity as it relates to metabolic health and conditions like PCOS. Could you provide some insight?
Yeah, and there's tons of patients that are infertile with PCOS going to infertility clinics. And I would tell you, the human body is designed to eat a low-fat, low-sodium, plant-based diet, and actually low protein as well. And so I would just eat that way and see how far it gets you. And then I would go through all the list of things that cause elevated estrogen levels, and I would avoid all of them. In a sense, what I'm saying is go back to being like Adam and Eve as much as you can, but keep your indoor heating and plumbing. I kind of laughed. There was some old song, I think it came out in the 1960s or something. We got to get back to the garden. And what I'm saying is there's some truth in that idea. That's what humans are designed to do. Our ancestors for, however many thousands of years, they walked around outside looking for something to eat, mostly eating plants. They got flat teeth like a herbivore. We don't make vitamin C because there's tons in our food. We got a long intestinal tract, 22 foot. We got seminal vesicles of a type characteristic of a herbivore. We've got hands characteristic of a herbivore rather than paws or claws. Okay, it goes on. And so that was what I would do to try to. That's what I would do to try to minimize PCOS, and I think there's a great chance of making excellent progress by doing that. Because if you don't do all these things yourself, you end up being put on more and more drugs, and each drug has a side effect, potentially leading to another drug or another problem. And sort of my attitude is, if I can fix a problem myself, I want to fix it myself. But one has to explore and study. So that'd be my thoughts on that.
Okay, yeah, that makes a lot of sense. Well, Green Warriors, please click like to show your appreciation for what Dr. Rogers shared with us today. Dr. Rogers, tell us about what you do and how we can find you.
Oh, yeah, I have a YouTube channel, Peter Rogers MD, where I make a lot of videos. I've written a bunch of books, too, that are available, like in Amazon. Basically, I was really successful academically and in sports, and then I got fat in my mid-30s as a physician, and I sort of felt like I was supposed to be this great doctor, Harvard trained, first in my class and all this stuff, but I was fat. My mother had cancer, metastatic, and my father had coronary heart disease, and conventional medicine couldn't help me. It couldn't help me lose my weight. It couldn't help my parents overcome their problems that much. I mean, don't get me wrong. The cancer doctors did a pretty good job with my mom. She was only going to live 2-3 years. She lived 11. But what I'm saying is, it was at that time in my life when I was trying to lose the weight. My family was making fun of me. You're fat. You're going to be diabetic. You're going to be impotent. And I'm like, oh, God. And they're like, if you're such a great doctor, how come you're so fat? And they're making fun of me. So anyways, then I started to really read and study. And I'm like, wow, all this useful information, it's sitting here in the nutrition, epidemiology, and toxicology literature. How come this was never taught to me in my med school or my training? And I was a little pissed off about that. I was closer to my mom than anybody else in the whole world. My mother died, and it was kind of sad and miserable. And I saw other people I really cared about get sick. And I'm like, how come nobody told me this? Since I was 18 years old, I've been studying all day long, every day, and working in medical stuff. And I was pissed off. If anybody would know, it would be me. And I didn't know, which means nobody knows. And so it really pissed me off. And so then I keep studying this, and I'm like, wow. There's a potential to cure all these chronic diseases. There's a potential to help all these people. There's all these healthy populations out there. And I'm like, this is so valuable. I wish people would know about it. But then you run into two problems. Number one, conventional medicine has zero interest in this because you cure a patient, you lose a customer. So they lose money on it. And number two, patients have all this passive aggressive resistance to it. I'd rather die than stop eating meat. And so, you don't get paid any physician for doing that. You get paid to quickly prescribe drugs. So there's no time that's reimbursed for educating patients. So as a hobby, I go on the internet and I make all these videos. It's all free. I wanted to be a great doctor. So I was pissed off. I got injured in college with my wrestling, and my career wasn't as good as I wanted. I was still student athlete of the year at Stanford, set the all-time record for wins in a season. But like my buddies were national champions and All-Americans, even world champions, and I was not as good as my friends. And it pissed me off. And so I wanted to sort of like redeem myself in my own mind's eye by becoming a great doctor. And now it's sort of like I've done that. But no one cares because there's no money in it, It's okay. I still want to help the pros. And so I'm trying to do that. And I try to do it. And whoever comes watch is fine. More people watch videos and read books. So I try to help them. What are you going to do? It's sort of like the people that are smarter and more motivated, they gravitate towards watching these educational videos, and they can learn a lot. Like I said, you can learn more in a week of watching educational videos than you could in 12 years of going to pre-med, med school, and residency. It's funny, but it's true.
Yeah, and hopefully maybe we can share these videos or your books with some of the physicians that we know and try to get them to learn a little more. Well, thank you, Dr. Rogers.
Yeah, I'll just tell you one thing that you'll think is a little funny along those lines. Mm-hmm. It's like sometimes I'll have a medical student tag along with me for a little while, and I'll say it right before they're gonna tag along with me. I go, you're going to learn more in the next, 1, 2, 3 hours, 4 hours, whatever they're going to be with me. I said, then you learn in your entire, 8 years before you met me. And they laugh like they think that's BS, but they politely smile. And then by the time they're done, they go, I want a refund on med school because they know it's true. But anyways, what are you going to do?
Well, so one person at a time, maybe you're going to spread the word. I think it's really best, especially when they're just entering the field, to get them at that point until they not wait until they've been in it for so long that they're intertwined with everything that's
Well, I can also tell you what
affecting them.
happens to a doctor. Once first of all, they just have to bust their tail, and it's very hierarchical, and they have to do whatever their senior tells them to do to get through residency and fellowship. And then once they're attending, they join a group, typically a private practice group or a university group, but they're still in a big group. And the new person is a low person on the totem pole. So they have to work all the lousy shifts, a lot more weekend work, a lot more night work. And they've been delaying getting married and having a baby. So they finally want to get married and have a baby or two. And now they're up late with the baby. They're trying to make partner in their group. So they're working lots of weekends and nights. They're totally physically exhausted. They've got no time or interest to read anything extra. And then let's say they go to continuing medical education. Continuing medical education is a joke. You go to like Florida or something, you sign the attendance in the morning, and then you ditch all the lectures and you take your family to the beach or something so your wife's not pissed off at you, and you don't learn anything. And for you take care of a patient, you get paid to sell them a drug, you follow the standard of care, you can't get in trouble. Whatever happens to the patient is irrelevant. It doesn't matter if they die. As long as you follow the standard of care, you can't get in trouble and you get your money. So what I'm trying to say is there's no incentive. You don't get any extra money if the patient gets better. You lose money if the patient gets better. There's no incentive for studying and reading and thinking. And so a lot of them, they never read another book again once they're done with, other than their medical studies, once they're done with their medical studies, because there is no reward for it whatsoever. All the boards exams and recertifications are based on conventional old textbooks that are out of date and wrong. So you have to know that to pass a test. But the rest of the stuff, you don't have to know. And like I said, if you cure the patient, you lose money. You're not paid to empower them. So I don't think things are ever going to change conventional medicine because it's a fixed system that generates money. It's based on money, not on patient outcomes. No one cares about patient outcomes. So it's good to know that when you enter the system that it is what it is and it's not going to change.
Yep, that's a lot. A lot of us that are watching and participating probably have had those experiences. I was in the cardiac ward, and the patient I was visiting was getting bacon and eggs for breakfast. So, yep, there's a lot to think about. But I'm glad that you're here to help us learn about this. And I really want to thank you, Dr. Rogers. Your dedication to empowering individuals to make informed choices about their health and well-being is invaluable. And it's evident that your work is making a significant difference in the lives of many. And we really appreciate your time and your expertise. And we look forward to having you back on the show. Dr. Rogers has been a monthly guest, so he will be back again next month. And Dr. Rogers, what's your final take-home message for our Green Warriors?
Well, you can tremendously improve your health by, eating in this way: low fat, low sodium, low protein, 100% vegan with no oils, no alcohol, no MJ, no tobacco, none of the stuff. You can dramatically improve your health by that way. Also exercise, get your sleep, have a sense of purpose, be religious. All that stuff improves your health dramatically, avoiding these estrogenic chemicals. So you can dramatically increase your health. Almost all of these common diseases are caused by some permutation of these bad habits and bad diets. So if you avoid them, you can fix tremendous amount of problems. And why not do it? It just makes sense. And so I'm grateful. And the proper thing to do is not to have an attitude of scarcity. Oh, this sucks. I can't eat pizza anymore. That's what, chumps and losers do, and they don't tend to do well. The smart people who have good outcomes, they say, thank God, all I have to do is eat this way, and I can prevent plugging up arteries all over my body. I can dramatically lower my risk of cancer. I can, optimize my body weight. I'll do it. I don't have to be fat, sick, and stupid like most people in America after 50. Thank God there's something you could do.
Yes, that's giving us a lot of hope, and I appreciate that. Green Warrior, tell us what you're going to remember about today's presentation. One of my takeaways is that your skin serves as a barrier to prevent water loss and protect against external threats, but then it's not impermeable to the lipid-based chemicals. And so there are certain lipid-based substances that can penetrate the skin. So let's think about that why some medications and skincare products are formulated to be absorbed through the skin, and why we really need to think more about what we are putting in contact with our bodies on a daily basis. And I also wanted to thank Just Tess Voice. She did the promos, she did the countdown, she did the intro. And Just Tess Voice, tell us who is coming up next.
Are you struggling with weight loss and finding it hard to resist constant cravings? Discover actionable strategies to overcome food addiction and achieve lasting progress. Join us as Harvard-trained expert Jen Hawk shares invaluable insights for navigating real food and real life without sacrificing your goals. Wednesday, March 20th, 3 p.m. Eastern, noon Pacific, on Be Green with Amy Live.
And thank you, Green Warrior, for tuning in and being a part of our community of Green Warriors. Let's continue to embrace the power of plant-based living for our health and well-being. And please subscribe for more empowering discussions. And remember, knowledge is power. And by staying informed, we can all take steps toward healthy living and happier lives. So please keep up the fantastic work of learning more and more about this lifestyle and the things that help us, and staying on track with your lifestyle, and just keep up. Together, we're going to continue to champion wellness in all aspects of our lives. And as a special thank you to all of you, I'm offering you 5 free recipes. So if you go to begreenwithamy.com/join, then I'll send you 5 free recipes that are SOS free, low fat, and they'll be very helpful to you to help you adopt this lifestyle or to stay on track with it. And if you would like to join me and Dr. Rogers, he's going to help me with my tagline. Are you ready? Okay, Green Warrior, you can type it in the comments. Until I see all of you again, remember, be strong, be well, and be green. Thank you, Dr. Rogers. Thank you, Green Warriors. And please stay tuned. We're going to have Dr. Rogers back soon.
Looking for really tasty recipes that are SOS free? No sugar, oil, or salt. How can it taste good? Well, if you like flavor, then you'll love this Be Green with Amy recipe ebook. Get your copy today. Click on the link in the show notes. Be strong, be well, and be green.